All right. Good morning, good afternoon, good evening for everyone joining from wherever you are joining us today. I'm just going to give everyone a second to join and make sure you're all settled in. All right. We're going to get started. I want to introduce myself. My name is Malvika Rendive, and I am the program coordinator at SID-United States. Thank you for joining our event today. The name of the event is Knowledge Management and Global Health. How do we go from knowledge sharing to knowledge use? And this event is hosted by the Health and Nutrition Workgroup. Before we get started and turn it over to our speakers and the moderator for today, just a few housekeeping rules and a little bit about SID-United States if you're not familiar with us. We are the largest and the most active chapter of the Society for International Development, which is an international network founded in 1957 to serve as a global forum dedicated to sustainable economic, social, and political development. We serve as a global town square for the international development community, bringing together people from diverse organizations, disciplines, and career stages in a neutral, independent forum to share information and discuss important issues and challenges facing our community, as we are doing today. There are a few different ways that you can get involved with us. You can check out some of our upcoming events and sign up for a weekly newsletter at our website, which is www.sid-us.org. You can join us for our 2023 annual dinner on November 15th, or you can apply to be a volunteer co-chair or volunteer workgroup associate or network associate. You can also follow us on social media to stay in touch with all of our different activities and events happening this fall. A few things to note for this event. This is a recorded session and it will be shared publicly through our networks and our social media channels. Closed captioning is available and you can access it through your own individual settings if you go into more. If you have any questions for our speakers for today, please post them in the chat box. We will try to make sure we have enough time to answer a lot of these questions, but in the interest of time, we may not be able to, and we apologize in advance for that. And with that, I will turn it over to Stephanie Vasquez, who is our co-chair for the Health and Nutrition Workgroup.
Great. Thank you so much, Malvika. Good morning and good afternoon to everyone on the call today. Again, my name is Stephanie Vasquez. I am the co-chair of the Health and Nutrition Workgroup for SID-US. Before we move into our panel discussion today, I do want to put a plug in for the co-chair position. You know, I've had the privilege to serve as co-chair for SID-US to arrange various webinars and support SID-US side activities that benefit the mission and international development for the past 2 years. And since I've completed my time commitment as co-chair, this will be my last event with SID-US, and it'll be an opportunity for a new co-chair to apply to the position. So I would encourage any professionals that are on the call in global health who are interested in working with other co-chair members or, you know, trying to put forward events of interest that are timely to think about this role. You know, what I've really enjoyed about being as co-chair is really thinking about the intersectionality of global health with other sectors, but also being a contributor to the SID-US mission as well. One other benefit is the SID-US team is very supportive, so it's not necessarily a huge time commitment. They're there to support you throughout the process and to support in events like today, and the planning and the actual day of event. If you're interested in serving as co-chair, Malvika will put a link in terms of how you can apply. And I'm also happy to talk with anyone offline about my experience as co-chair. So now let's shift gears into the purpose of the panel for today. And thinking about this panel, you know, I was inspired by a quote that I heard at a recent SID-US annual meeting, which stated, over the last 2 years alone, 90% of the data in the world was generated. And thinking how that applies back to global health, you know, the practitioners in the field have access to more information than ever before, and the relationship with this knowledge continues to change and evolve. And so for today, we have thought leaders in the space of knowledge management and global health who are evolving their approach to ensure information and knowledge is made available to the right people at the right time. So we have structured a conversation for today to understand how knowledge management has been valuable to advance global health and how knowledge management practices adapt when challenges are presented. So our moderator for today will be Piers Bocock. I have the pleasure to work with him at Bixal as he leads our international team. And previous to joining Bixal, Piers has held roles as a co-founder for Acute Insight and Change Funder. He served as chief of party for USAID's Learn Contract and director for KM Communications for CGIAR. He's also taught, presented, and published on a variety of topics and holds a part-time faculty position at the Hopkins Bloomberg School of Public Health, for which he's been acknowledged for excellence in teaching numerous times. So I'll go ahead and hand it over to Piers, who will serve as our moderator for our conversation. Over to you, Piers.
Thank you very much, Stephanie. And Malvika, maybe we could just, we can bring the slide down so we can see the speakers. I'd like everybody to see their faces. Thank you, Stephanie. Thank you, Malvika, and thank you for SID for hosting this event. It's obviously a huge pleasure for me to be here and to welcome everyone to this discussion about knowledge management and global health, a topic that is near and dear to my heart, so much so that my bio is out of date and still references the fact that I hold a position at Hopkins, which I don't anymore, but I did with Tara for many years. And to talk about the evolution, how we can shift from just knowledge sharing, which has been really important, to knowledge use, and when possible, talking about how we make sure that knowledge in support of global health programs is relevant, is appropriate, is timely, and is getting into the right hands at the right time in the right format. So let me briefly introduce our panelists. I'm really pleased with the panel that Stephanie and team have pulled together, because it offers, I think they offer a variety of perspectives. So first, I'm going to start with Leonard Bikinesi, a specialist family physician and HIV technical expert with more than 15 years of clinical experience involving HIV and TB care, treatment, prevention, public health, and quality improvement. Currently, as Chief Clinical Mentor at the Ministry of Health and Social Services, he leads Namibia's Clinical Mentorship Program, which provides ongoing capacity building to healthcare workers on HIV and TB care, treatment, and support. Develops and implements HIV/TB guidelines, policies, circulars, and standard operating procedures, and continuously strengthens the provision of comprehensive HIV and TB services with a focus on patient-centered care. Dr. Bikinesi is also the Project ECHO lead for Namibia and ECHO Institute of Africa ECHO consultant. And there's even more about Leonard on the SID page, but I'm going to now introduce, and so welcome, Leonard. Really a pleasure to have you here. Next up, Tara Sullivan, former colleague, wonderful friend, happens also to be an expert in knowledge management and monitoring and evaluation, with over 20 years of experience managing complex projects that include a wide range of partners, numerous products and services, covering a variety of family planning and reproductive health and other health areas, and multiple stakeholders and audiences. Dr. Sullivan has made significant contributions to knowledge management for global health and development theory, practice, and research by identifying gaps and bringing knowledge management experts together to develop seminal guidelines for knowledge management program design, implementation, monitoring, and evaluation. And Tara also happens to be the project director of the Knowledge Success Program at the Johns Hopkins Bloomberg School of Public Health and their Center for Communication Programs. So welcome, Tara. And last but definitely not least, Zach Wall is the founder and CEO of Enterprise Knowledge, the world's largest dedicated knowledge management consultancy. For nearly 25 years, Zach has worked as a KM consultant, delivering strategy, design, and advanced implementation services for some of the world's largest and most complex organizations. Zach's experience spans the globe and includes deep experience with a wide array of public and private organizations, including the IMF, the World Bank, National Park Service, Walmart, and Nike. Zach is also co-author of Making Knowledge Management Clickable, a detailed guide to KM systems, published by Springer Books in 2022, and is the host of KnowledgeCast, the #1 ranked KM podcast in the world. So what a panel, wide range of experts and experience, and I'm excited to get into it with them. My goal as moderator is to tee up some questions that I hope will surface some practical examples of shifting from just knowledge sharing to knowledge use in global health from a variety of perspectives. Now, I've got a number of questions I could ask, but I have 3 ready to go. And depending on how the conversation goes, I have more that I can ask. And what I'm going to do is I'm going to take turns inviting panelists to respond to those questions and then give the others the chance to contribute and share their perspectives. We'll keep the discussion to the panel until about 9:40 or so, and then we'll open it up to questions from attendees. So please feel free to post questions in the Zoom chat channel. But please also feel free to just comment and perhaps the kinds of things you might whisper to the person next to you if you were in an in-person event. Put those into the chat, your thoughts, your musings, your reactions, perhaps similar experience, and we can have some of that conversation going in the chat. Sound good? All right, so let's get started. Zach, I'm going to put you on the spot first because I know that this is a question you like to ask your podcast guests. So, how do you define knowledge management?
Yeah, thanks and welcome everybody. So when I define KM, first I acknowledge the fact that there's a ton of definitions for KM and very few are wrong, though some are. But the key is for every organization to set their own definition and ensure that they're not just providing the definition, but they're giving a for example or a for instance. What's it actually doing within the organization? My first sentence is always pretty similar. It's KM engages people, process, content, culture, and technology in order to help an organization basically create, capture, manage, enhance, find, and then connect. And all of those things, all of those words are verbs, and they're very, very purposely verbs because KM needs to be action-oriented. It needs to be something that actually solves problems for the organization. Now, again, that's the first sentence. There's a whole paragraph, probably a whole page that goes after that, but that's always where I begin.
Awesome. Thank you, Zach. All right, Tara, you're up next. How do you define knowledge management?
All right, thanks for the opportunity. And I think listening to Zach's version, I have the too long didn't read version of my knowledge management definition because it includes a lot of your components, but it's a little bit shorter. So at the Knowledge Success Project, we define knowledge management as the process of collecting and curating knowledge and connecting people to it so they can act effectively. So to your point, there's a lot of pieces that we want to look at the processes of collecting, curating knowledge, connecting people to it. And that action component we also feel is so vital to include as well. So that's the short and sweet version that we use. Over.
Thank you, Tara. Now, Leonard, you have the unenviable position of now being put on the spot to offer your definition of knowledge management. How do you explain this to folks?
Thank you very much. I could simply just match the two. Yeah, I think to me, there are certain phrases that comes or words that comes to my mind in terms of, talking about organization, the different processes that you're going to apply in organizing that knowledge, the sharing part, the application component of it. But I think most important for me is the feedback. How do you ensure that the knowledge is actually making a difference? So there need to be sort of in knowledge or feedback loop. And especially working in Africa and having had an opportunity to work with the different African countries, I think a key component of knowledge management is that the knowledge has to be timely, it has to be relevant, it has to ensure that it's adaptable to the different cultural and backgrounds of different people that you are dealing with. Thank you.
Thanks, all of you. And let me just highlight something that is implicit in what I heard from all of you, but I would just like to make it explicit, having had to try to justify and explain knowledge management sometimes to the non-converted over the years. It's an element and a phrase that we've heard the U.S. Agency for International Development use when they talk about some of their other practices, particularly around collaborating, learning, and adapting. But what I heard from all of you was that knowledge management is an active and intentional and systematic and hopefully resourced approach to what you're all to your definitions and applied to context. And so the context we're talking about here is global health. So the next question, which I think will lead to maybe some discussion, is, and I'm going to come to you first, Tara. So just putting you on notice. So as experienced knowledge management practitioners in the international development space, as well as beyond, could you share with our audience and with each other some practical examples of knowledge management interventions or approaches that have contributed to successful knowledge utilization and improved health outcomes and or delivery? So how do we take that theoretical definition and put it into practice? Can you give us some examples? Tara, to you first.
Yeah, thank you, Piers. And Piers already knows that this is an area that I'm quite passionate about, including trying to think about how we can intentionally design and systematically implement our KM activities so that they do contribute to that increased knowledge, to inform decision-making, to improving service quality, enhancing our health systems, and then also improving health outcomes. So thinking about those health outcomes at the client level, for example. So over the years, I've been very fortunate to work on US funded work where we've been able to, at the country and regional level, implement activities where we've been able to use some rigorous evaluation designs and have been able to link our knowledge management work to outcomes. So to give a couple short examples, in Malawi, we used a technique called net mapping, which showed that community health workers went from passive recipients of information with little influence to active information agents who saw and provided information to provide health services. And this was all via a mobile health intervention. And so what we were able to do by looking and mapping the stakeholders over time is that there was quite a striking difference before and after. We introduced a mobile phone intervention. As part of that intervention, a whole entity, the community health workers, became part of the net map where they weren't before the intervention. So there was a whole lot of other outcomes that we saw from this other than the communication aspect. We saw that we were able to identify when there were cases of certain kinds of diseases popping up in the community, if there were shortages of supplies, and then also able to kind of see how we could save some time and money through that intervention. A second intervention in Bangladesh, and I'm highlighting these both because we were able to use fairly rigorous evaluation designs, which is not something that you find often in our knowledge management work. So another example was when we worked in Bangladesh. We called it our Bangladesh Knowledge Management Initiative. As part of this, the evaluation design was we used a household survey, a provider pre and post-test, and a capacity assessment because we were working very closely with government units and making sure that we were shoring up capacity within the government. What we found is that the field workers were empowered by having relevant information at the point of care. And this translated into them having some increased credibility within their community. The field worker knowledge gained through these digital health packages also diffused to the client. So we also saw a positive effect on knowledge, client knowledge, and behaviors. So those are just two short examples where we used some interventions where we were making sure that knowledge was at that point of care and it translated into improved performance on the provider side, which also translated into some changes on the client side. And in the spirit of keeping things short and sweet, I will just end by saying that there's a whole lot that we could unpack related to measuring knowledge use. It's been sort of my career goal has been to be able to measure this better. And just to put a quick shout out that if you are looking at measuring your knowledge management interventions, there's a group called the Global Health Knowledge Collaborative. As part of the group, we developed a logic module, which really helps you to connect your knowledge management activities and see how they can contribute to health outcomes at different levels. We have an indicator library that we've created, a series of instruments that you can learn from. So there's a whole lot of guidance out there that I'm happy to share with you. And I provided some links to the organizers if it's an area you're interested in. So I'll stop there, and I'd love to hear what others have to say on the topic.
Thank you, Tara. And I love the practical examples of supporting the shift from passive recipients to empowered implementers at the point of care. That's wonderful. Leonard, same question to you. Some practical examples of knowledge management that have contributed to successful knowledge utilization and improved health outcomes or delivery.
Thank you. So over the past years, I had an opportunity and the privilege to work with Project ECHO, not only in Namibia, but also in helping other countries to set up their own ECHO project. And what I'll talk about and examples is really something that is, I think it resonates in most African countries. In most African countries, there are challenges when it comes to knowledge management processes. If you look at the capital cities versus the peripheral towns or communities. And what I noticed when we started using ECHO in 2015 as the first African country to do so, we're looking at HIV care and treatment. And then there was so much need for healthcare providers to acquire knowledge and to be able to implement it in their communities. So at the peripheries, that's where we had challenges. But once we started using ECHO and we connected as many communities as possible, what we noticed over time was the gradual movement and of knowledge and information to our colleagues, especially those in the rural settings. And task shifting started to happen. They became more confident in the care and the use of the information and in the knowledge that they were acquiring, especially in management of complex HIV-related complications. And the impact of this was that outside the gains, the immediate gains of the healthcare professionals, such as a feeling of reduced professional isolation, self-certification at the workplace, there was also an increase in easiness of accessing of continuous professional development points. We also noticed that it actually translated to patient outcomes. When we did evaluation and we're comparing those centers that had ECHO connected versus those that didn't have ECHO, the viral load suppression of those patients was much better compared to the viral load suppression of those sites that didn't have ECHO. But in addition to that, we also noticed some changes in terms of how people were implementing best practices and evidence-based medicine, in this case, in terms of HIV care and treatment. Whilst it was fragmented in those areas where there was no ECHO, in areas where there was ECHO, it was almost like standardized. It was almost like you had created a community of people applying similar evidence-based medicine. So that's an example that I can think of sharing, which actually translates to patient outcomes. And I've seen this occurring in many other countries like Zambia, Uganda, where they're also running similar HIV ECHO programs.
Leonard, can I just ask you to clarify or explain a little bit more about Project ECHO and how it does that? What I've heard is some of the outcomes, but people in this webinar may be interested in what are the approaches, the knowledge management approaches that Project ECHO uses to create these results.
Yes, so it's a hub and the ECHO model is based on a hub and spoke model. It has got 4 core principles where we use technology such as Zoom like this and we connect to, the hub connects to multiple spokes in different areas in a geographical location. And during the sessions, there's a sharing of best practices, usually through a very short didactic presentation. But at the cornerstone of the eco model is case presentation and case discussions, which the spokes do. And then the other component of the model is to do with evaluation. So there is a deliberate, ongoing evaluation in terms of how much are the participants acquiring in terms of information, how much of that information are they actually applying? Is it making a difference? So there's that ongoing evaluation. So it ceases from just being a usual webinar where people just meet to being something that people actually put together and deliberately make it in such a way that people actually benefiting from what is being shared from the experts that are usually at the hub. So briefly, I think that's what I would say is the eco model with all those principles interplaying together.
Excellent. Thank you, Leonard. And we may have more questions from our participants about that, but let me turn this to Zach. Zach, you've got a very broad and global range of experience in this, but in talking about global health, can you give us some examples of KM approaches or interventions that have contributed to improved health outcomes?
Yeah, absolutely. So both my co-panelists did a great example of a great job of talking about knowledge capture and then really the measurement of that work and the efficacy of it. I'm going to jump all the way to the end and talk a little bit about artificial intelligence, which is obviously in the news a lot today. We were hired by a global development bank, found that they were doing a pretty good job of actually capturing their knowledge. When a project closed out, they were doing debriefings, they were generating a ton of lessons learned and best practices, but they were failing to then disseminate that captured knowledge. They weren't sharing it. And even when they advertised that they had it, when a new project began, folks weren't reaching out. And so they engaged us to help them solve that problem. What we did is we built a knowledge graph based on an ontology for them that they ended up calling the brain. So I guess that says that they liked it, they got value out of it. But what it basically did is anytime a new project began, it looked at the characteristics of that project. What's the budget? What's the timeline? What's the topic or goal? What's the project team and makeup? What's the geopolitical climate? All of these different factors. And it would push lessons learned and best practices from previous projects to the project owners. And at first they said, well, this thing isn't working. We're launching an AIDS education project, and it just sent us lessons learned from an ODF project on the other side of the world. But when they started digging into it, they realized that there were similar characteristics to those projects that could be applied, and basically broke down silos. It allowed them to leverage all of the organization's collective knowledge rather than just that fit within the very tight constraints of project type or project location. What ended up happening is not just that they were leveraging that captured knowledge, they were actually reaching across the globe to colleagues they'd never met who had generated that knowledge in the first place, collaborating more effectively, following up to learn more, and actually generating even more knowledge as a result of those interactions. So to me, that's a great example of A, how technology can play a role, an enabling factor, as long as the right things are done first, as the co-panelists expressed, but B, how knowledge management begets knowledge management. If you begin to share knowledge, people will have a natural inclination to reach out and generate more as a result of that.
Wow. So we've got quite a range of examples, and I can imagine that Leonard and Tara would love to have the capacity to leverage artificial intelligence. But Zach, following, sort of as a follow-up to that, what do you think are some of the principles that you built into this intervention that leverages the latest technology that there's huge debate about, right? What are those principles that pre-AI you think are common to what you've heard from Tara and Leonard? What do you tell the artificial intelligence to be looking for as it relates to effective knowledge capture, sharing, and utilization?
Well, you just nailed it, right? I mean, AI in and of itself is nothing without the human in the loop and without a lot of human-centric design. And so what you tell the AI is what your end users say they need and how they behave, how they act, and how they naturally talk. It's all about basically designing something that will actually help to complete the missions of the end users. There is obviously a ton of conversation about ethical AI and the human-centric design elements and how AI can go awry, but we're not building Skynet here. At its most basic form, as long as you define the right use cases and engage your stakeholders in the designs of these systems, they will be able to answer the questions that one would want to ask. And moreover, they would help an end user discover knowledge that they wouldn't have naturally gone looking for. So it's about understanding your users. It's about going beyond the natural constraints that users put their questions in, and then creating a model that will help to break down barriers while also still working within the constraints of the organization.
That's fantastic, and that is super helpful. And I want us to hear that there are principles that we've heard from all of you that can be applied leveraging different elements of technology, whether it is a basic SMS phone application that Tara was talking about, or leveraging synchronous and collaborative Zoom capacity, or leveraging the potential and the power of artificial intelligence. What I hear, and I know it's something that we believe implicitly, is that it's never knowledge management for knowledge management's sake. It is knowledge management, capture, sharing, appropriate delivery in service of what the end user needs. And that's where the ensuring that we know what we're trying to do so that we can evaluate it. Is that fair?
100%. And moreover, I just want to make the point that project could only have happened at the time it happened because that organization had spent years instilling a culture of knowledge sharing, defining content types and taxonomies to archive their knowledge effectively and to enhance it and connect it. Really boring content governance programs to keep their knowledge fresh and to vet it to make sure it's right. Years of the less sexy knowledge management efforts had to go into enabling that technology. And so what I don't want to leave the participants with is this idea that AI is going to fix everything. KM is actually a critical foundation to making AI happen today.
Tara or Leonard, is there anything that you'd like to add on to what Zach said before I go to the next question?
I think there's one thing I would add, and I'm, excuse me, certainly no expert on this, but I was recently exposed to some information from a guest lecturer, part of the Hopkins community, who talked about how we could use AI as part of our monitoring and evaluation work. And it was really fascinating to me, ways in which we could really save time and money, excuse me, I'm losing my voice, by way of being able to use data sets and being able to put them with the right commands, et cetera, to be able to get them coded for us. So I think there's a lot of potential there, even to help us with the measurement that we're focusing on today, and how do we better capture use as part of knowledge management.
Thank you, Tara. And Leonard, I'm going to come to you first on this next question, but I wanted to give you, if there's anything else you wanted to say to this conversation.
Yeah, I think similar to what Tara said, in September, there will be a Meta Echo conference in Albuquerque. And one of the highlights there is, AI and its use in echo and in evaluation. So it's pretty exciting that, everyone is thinking about how we can, take advantage and leverage on the power that AI brings. So I'm looking forward to it. I'm not an expert, and I'm just curious as much as everyone else about how AI is going to be used in such areas.
Excellent. Thank you. And this is the perfect segue to the next question. So I believe, and no surprise, there's nothing mind-shattering, but over the past few years, we as knowledge management, organizational learning practitioners have been presented with a number of challenges and opportunities that have perhaps caused us to need to adapt. And the opportunity and concerns about AI is just one example. In addition, obviously, we have had to navigate through a global pandemic, one of the few truly shared experiences around the world. We're also seeing in front of our eyes in real time the impacts of climate change. All of these are contextual factors that maybe figure into how we try to leverage knowledge management as a critical intervention in global health programs. So, as I said, Leonard, I'm going to come to you first with this question, but I'm wondering if you can give me an example of a large contextual challenge that you've faced over the Project Echo has faced over the past couple of years, and how you have leveraged knowledge management to face that challenge and applied it to continue your support of global health programs.
Yeah, so, as you were asking the question, I thought about a number of them, thought about COVID-19. I also thought about crisis. And I think let me talk about the crisis, and maybe this time I'll talk about COVID-19. So think about crises, such as wars, and the way we do things, especially they have a potential to disrupt, how effective KM is during this crisis, because everyone is really anxious, or their concerns are about their safety. And this has been the case in one of the countries in Africa, in Sudan. A number of my colleagues work there, and some are supporting that country. And what they've told me is that when there is a civil war, it disrupts a number of systems, and especially healthcare systems. But in terms of what it does on the knowledge management aspect, is that there's a high turnover of experts, and people are able to, actually absorb and acquire that knowledge and share it, or even implement it to transform it into, outcomes. And that's one of them. And the other part is those few people that are available to make a difference in terms of maybe caring for patients. They don't have the expertise, they don't have the knowledge and skills to do so. So as things are unfolding, there is a greater need of actually coming up with, systems that are adapting to such kind of an environment. So the team in Sudan launched an ECHO program, and the aim of that program was to help professionals. Some of them are actually community-based professionals. These are really lay workers, and they started with things which were very simple, like just basic trauma care skills. And then they started increasing the amount of information that they were sharing to things like advanced care. What do you do in this situation, and what will help you to, come up with, referral systems and so forth. And then they get sort of a feedback on how these individuals are applying such information and knowledge. We usually look at whether it is making a difference in terms of knowledge gained and so forth. But in this case, because it's happening real time, their feedback is how many patients or clients have they treated that day, and what knowledge or skills they use. Perhaps they discussed it a few weeks back, or the gaps they identify as they were dealing with such casualties. So it has been interesting how, we always think about having a nice formal way of, getting knowledge. But in this case, it's a person who is in a very small room in a hospital, afraid of their health, afraid of their own safety. And they're getting this knowledge, and they've been very innovating. They're using social media platforms like Telegram because it has got low bandwidth in terms of data. And they continue to share cases and to share knowledge, and also to share some of the common injuries they are seeing and how to care for them. So it has been interesting how, people have the power to adapt. As long as knowledge is available, they can adapt in terms of how they're going to share it and how they're going to apply it. So just maybe let me just share this one for now.
Thank you, Leonard. That's great, and it's important to emphasize that knowledge management programs come in different shapes, sizes, approaches, and what you have provided is an example of how KM can be nimble and life-saving and timely and adapting to what is absolutely necessary on the ground. So thank you for that. Zach, I'm going to come to you. You've already brought up artificial intelligence. Tell us about a challenge or a shift in context in global health programming that you have seen or been able to apply knowledge management approaches.
Yeah, well, I think we can all agree the last few years have been pretty weird, right? And so I was recently speaking with the CEO of one of the major global health organizations here in the DC area, and she admitted that COVID-19 was a little bit of a KM wake-up call for them. Like a lot of these organizations, they had their headquarters staff, the folks that could come into an office like this, air-conditioned, great internet every day, and then all the folks out in the field completing the missions. And when the pandemic hit and all of these headquarters staff had to scatter and go work at home and pick up their gear and just go, she said it was very humbling for her. She realized, oh my gosh, this is what I ask my employees to do every day, and I'm not arming them with the right tools to do it. She was ripping her hair out. It was hard. She couldn't get access to the right people, the right knowledge. Does this sound familiar? And so they are actually reinvesting in KM in a way that actually sounds very familiar to what Leonard just said. She's referring to it as lightweight KM. How can we do the little things, the easy things, the things done in minutes instead of hours, in order to arm all of our staff with the ability to share their knowledge and then reap the benefits of that shared knowledge throughout the entire globe? One of the things that we're helping them with is this idea of high value moments of knowledge capture. Rather than just saying, share best practices, share everything you have, find little opportunities at key moments in an initiative or project, after a milestone, after an aha, after a big mistake, and make it very easy for your staff to share those moments by video, by a very simple text entry on a mobile device, by even email. And then create mechanisms for that to be cataloged and shared in a core repository for others to benefit from it. So I think that the challenges and the weirdness of the last few years has created a wonderful opportunity for KM. I think that people at all levels of every organization have a greater respect and understanding for it. I think we're at a wonderful inflection point.
I want to, as a friend of mine would say, a foot stomp on that one. Plus one it. I work with a lot of different international development funders, and their KM and organizational learning leads. And they found, in a world where sometimes we have to justify our existence, they found that suddenly they were being called upon to connect people, to say, how do we stay on top of this unfolding situation? Nobody knows what's going to happen, and yet we have to keep people connected. It was a real value demonstration for KM practitioners. So I appreciate that. Tara, over to you.
Thank you, Piers. And I appreciate the perspective that Leonard and Zach both shared. And I really love the idea of light KM, and also just making your knowledge management intervention fit the resources you have and the exact problem that you're facing at the time. So really appreciate your remarks. One of the things that I had wanted to share about, just related to thinking about knowledge management and public health emergencies, our team has had some experience working as part of Zika, and then now more recently as part of the COVID-19 pandemic. And as you've all alluded to, like, knowledge management really does play such a vital role in these public health emergencies because of the rapid pace and volume of information that is changing so rapidly that sometimes it's changing on the hour. And so being able to keep up with that information and making sure that people have reliable, credible, on-time information is so important. So our knowledge management initiative can curate and synthesis all that latest knowledge so that it's actionable and can be used in the right moment. And also, I think we have opportunities, which you all talked about, is just thinking about how we can bring people together to share tacit knowledge. So we're really learning from in the moment, and then also learning from our experience as we're looking back on the interventions that we've put in place. Knowledge management also plays a role just in terms of making sure we're using tools and techniques that are the same. So making sure that we're being consistent in our messaging and just really addressing all those issues that we saw come up as part of the COVID pandemic in terms of mistrust and confusion, all of this in the midst of a public health emergency. So I had wanted to just talk a little bit about some of what our project has been doing, Knowledge Success, with some funding from USAID's Global Health Bureau. There's a recognition that they really wanted to use some knowledge management and apply it to the COVID-19 vaccine response specifically. So we've looked at documenting and disseminating information about the COVID vaccine landscape, curating some resources, synthesizing knowledge, facilitating some knowledge exchange events among implementing partners, and then publishing some of those lessons learned. So some of what we're doing is trying to create systems so that our knowledge management work moving forward is going to be systematic, because I think we've all learned from experience that if you're doing knowledge management in an ad hoc fashion, you're not going to get the kinds of results that you would like on the back end. So one of the things we're doing is creating a roadmap for public health emergencies. And so it outlines a 6-step process where we're really looking at that generation, collection, analyzing, synthesizing, and sharing knowledge all throughout a global health emergency. One of the other things that we've done as part of this is that we've hosted regional learning circles on COVID-19 vaccination. And one of the things that I love about this is, okay, we did this both an Anglophone learning circle in Tanzania, and then we did one Francophone in Senegal, both earlier in this year. And if you're not familiar with learning circles, it's this participatory peer-to-peer learning program for global health professionals to really discuss and share, focusing on what works and what doesn't work during these, during these kinds of times. Where, excuse me, I'm losing my words, specifically here looking at the COVID-19 vaccine implementation. So here we brought together USAID implementing partners, and their task was really to kind of explore, okay, what went well, what were some of the challenges, all related to vaccine programming among high priority populations, and then really identifying what are those lessons learned and how can we apply those lessons learned to future emergencies. So there's more that I could discuss in terms of the activities that we've undertaken, really thinking about, well, what's KM's role during public health emergencies? And it really comes down to really getting people the right knowledge at the right time as it's rapidly changing, and also letting people know what other people are doing. so that we reduce that duplication of effort that we often talk about in knowledge management. So I think I'll stop there. There's more I could say, but yeah, lots of lessons learned through the COVID-19 pandemic.
Thanks, Tara. And I realize we're already past when I wanted to stop. It's just so fascinating the conversation, but I wanted to stop to see if there were questions. And I don't necessarily see any questions in the chat, but there is a comment. And I put this out, it's almost a debate topic here because I'm not sure that Zach would necessarily agree with this. The comment is, the strong connection between monitoring, evaluation, and learning, MEL, and knowledge management in international development. Maybe that's something that could be, we've seen more of, and I can ask Tara and Leonard to comment on that. This is quite different from traditional corporate-focused knowledge management, says the comment. I feel like we could have an hour-long debate about this. Leonard, I'm going to put you on the spot first. How has knowledge management been able to contribute to monitoring, evaluation, and learning that is so important to our funders and to know that our health programs are having an impact?
Yeah, so I think that question really entails I think some of the lessons learned during COVID-19, in the sense that we realized that there was a need to actually find out what the information we are sharing, where people are applying it. We needed to sort of to get a feedback loop in terms of was it making a difference? And what we realized, especially in the COVID world, during COVID and during HIV, in my management of HIV, is that at times having good knowledge or good information doesn't necessarily mean that it's being applied or it's being implemented. And I think that's where the whole evaluation comes in. And at times it can be very easy to evaluate the other components of knowledge management, but forgetting that ultimately the most important thing is the outcomes, the utilization of that knowledge. And that's what I've noticed, working with different groups and different people. And of course, when you're working with different funders as well, there is a need to justify, the cost effectiveness of whatever system you're putting in place and whether it's making a difference. And how it's making a difference, I think that's something that is also debatable in terms of whether it's just acquisition of information, sharing of it, or actually translating to, in this case, patient outcomes. But I think once you have a robust knowledge management system, it can't be robust without an evaluation company, without monitoring and evaluation, especially in terms of the patient outcomes or the outcomes that of the organization desires to have, the end product of it. So I think, in short, that's what I can think about in terms of this subject.
Thanks, Leonard. Zach, I'm going to come to you to give you the chance to, in a sentence or two, agree or disagree with that statement.
So I'm going to need more than a sentence or two, especially because I've been a consultant my entire life. So the answer is it depends, of course. Here's the deal. Any good KM program will have measurement built into it and a positive feedback loop. If the program is not completing what you need it to, you'll shift it. If it is, then you'll do more of it. It's pretty simple. What you're measuring depends on what your KM use case is. When Nike says KM, they're looking at their customers. They care about lift and conversion. They want people to put more things in their cart, and they want people to complete the transaction. I actually like those words, lift and conversion, that are often used in e-commerce to consider any KM program. What we're talking about here is sharing knowledge, but at the end of the day, we want the same thing, lift. We want people to get more knowledge in their cart, and then we want them to convert. We want them to act on it and actually complete their mission as a result of it. So that same concept or measurement really, really tracks. I could go to Tara's previous point about COVID-19 and talk about how a lot of our clients leveraged KM to power their knowledge at the point of need or learning at the point of need when things were changing every day. And updating directives and cleaning procedures and this and that. From that perspective, the measurement of KM was, are we seeing less people getting sick? Are we seeing less fines because we're not following the regulations? So measurement is always critical in a KM program. What you're measuring and what you're doing with that is the thing that's going to be different.
Thank you, Zach. And Tara, I'm going to come to you give you the chance for the closing argument. You said this was your life's work, connecting knowledge management to monitoring, evaluation, and learning. Make the closing argument that knowledge management is an essential part of the toolkit.
Thank you, Piers. So one of the things that you've talked a little bit about, Piers, as part of this webinar is how important it is that we have knowledge management that's systematic, intentional, resource. I feel like we've had many conversations around this. However, when we think about our global health work, we're working towards goals that are transcending geographic, sectoral, organizational, financial boundaries, and we have very little resources. Knowledge management provides us with the tools that can help us optimize those resources and also ensure that our efforts are coordinated and effective. So my closing statement or my feeling is that knowledge management is a global health development imperative because it provides the tools that are going to foster that ongoing learning and knowledge application that are going to help us to maximize those limited health resources and achieve those health outcomes.
Wow. Thank you. Perfectly nailed. I want to thank the three of you. I think that there's often people think that knowledge management in the international development world is different from perhaps knowledge management in the corporate world, and knowledge management for global health is different from other elements. But what it comes down to is the points that you've all been making, keeping the end user in mind, whether it's the conversion quotes that Zach is talking about, the action. It is about connecting people that Leonard has been talking about to save lives. It is about it as a core and essential component of an intervention. So thank you all. Thank you again to SID, and I am for hosting this event. I feel like we could go on for a long time. Leonard, I hope that you can share some information about that ECHO event in Albuquerque. And at this point, I'm going to turn it back over to Stephanie for any closing remarks. Stephanie.
Great. Thank you, Piers. Thank you to all on the panel. I know when we were planning for this event, we recognized that 1 hour would not be enough time for this conversation, and it just feels like we just scratched the surface on some important themes. But we hope, for those that were listening in, that it was an opportunity to think about knowledge management in a different way, and maybe, think about knowledge management, think about different knowledge management approaches that might be relevant to your work. So we will put a survey out to get your feedback on the session. And we might want to think about a round two conversation, because I feel like there's so much more to be discussed and so much value here to the global health space. So thank you again, everyone, for your time, and hope you have a good day. Thanks, everyone. And thank you for the SID-US team for your support in getting this panel up and running.